Only 36% of Hispanic and Latino adults across the country who needed mental health help actually received services. That's compared to 52% of white Americans. And this is according to the 2021 National Survey on Drug Use and Health. In Utah, the Latino Behavioral Health Center is working to increase the percentage of Latinos and Hispanics who have access to behavioral health care. Fox 13 News reporter Darian DeBrule shows us how the center's new space is helping them bridge the gap.
All of us can use a little help every now and then.
For 10 years, the Latino Behavioral Health Center has been working to reduce behavioral health disparities in the Latino community.
Some of the major barriers, I would say, are going to be lack of insurance, lack of accessibility to affordable insurance, and then lack of providers and caregivers that are of the culture or culturally responsive and speak the language.
Executive Director Javier Alegre says the center provides services like therapy, peer support groups, and much more, provided in Spanish.
Trying to share your inner thoughts, your frustrations, your trauma, language kind of becomes problematic in your own native language. So imagine trying to have this conversation with a provider that is not necessarily someone that you can relate to.
They also pair clients with professionals like Laura Santos, who share a similar culture.
There are services. Sometimes we don't know. Sometimes we think that just because we are immigrants, we don't have the same rights or we don't have the same opportunities as the people who were born here. But we do have services.
We relate. We have similar history, similar trauma, historical trauma.
Now the center is even better equipped to help new and current clients in a new building that has over 2 times the space and amenities for staff and clients to enjoy.
When you walk around, you'll see 2 living rooms, 2 sitting areas, a coffee shop area. You'll see a dining table, you see a kitchen. You see a home.
Being here and interacting with clients, interacting with people who come here, it just makes feel like this is our culture. And for me, as an immigrant myself, I feel like I'm at home.
The center has made great strides for Utah's Latino community, but Alegre says there are still systemic behavioral health barriers that need to be addressed.
If you are looking to reform rules, system, policies, and procedures, you need to have equity, integration, accessibility, culture, and language, part of the basic foundation of a new system. So we have to start thinking a bit more uniquely about other communities and marginalized communities.
In Salt Lake City, Darian DeBrule, Fox 13 News, Utah.
If you or someone you know needs support, you can call the Latino Behavioral Health Center's warm line. The number is 801-587-1055. You can also contact your local center directly.